Hey, there it is.
There it is. Okay. So,
Yeah,
welcome to our January monthly wellness webinar series presented by Wellness Within Therapy and Counseling Services. If you could go to the next slide there, Kayla, for me. So, just a little introduction of who we are as a clinic. So, we are a team of compassionate mental health therapists dedicated to providing mental health and wellness services to individuals, to families, to couples, promoting overall well being and empowering them to lead fulfilling lives. So, the reason why these monthly wellness webinars were created initially by Kayla is just because mental health resources are very accessible, which can be great, but also can be a bit of a challenge because of maybe misinformation that gets out there. So, the goal with these webinars is to ensure that members of our community have accessible evidence based strategies and information that they can trust. So, that is why Kyla decided to start putting these webinars on. And just a quick introduction to the team here at Wellness Within. There is quite a big group of us here that are registered social workers and registered psychotherapists. So Kyla, who is the clinic owner, is there at the top, and then Samantha, Ashley, Britt, Darcy, Sarah, Megan are all, and myself, another Sarah. We also have Karina, who does Reiki here at the office. And then two new additions, Ashley and Caitlin, are here now as well. So, yes, again, a group of either registered social workers or registered psychotherapists, um, all kind of having different specialties and areas of expertise. So we do have Kayla Buck joining us today. She's a certified mental performance consultant. So I'm going to hand it over to her and she can kind of introduce herself a little bit more and kind of jump into it.
fantastic. Thanks so much. So my name's Kayla Bach, and I'm a certified mental performance consultant. And today we're just going to talk about mental performance and just understanding mental performance for which are skills for sports performance and life. I've been in the field for about 10 years, and so I support athletes, performers, and then the people who support them. So a lot of times that looks like coaches and parents. So, the agenda today, we're going to look at what is mental performance consulting and what it isn't. Where does mental performance fit into mental health as a whole? You'll hear me say the term CMPC. That just stands for Certified Mental Performance Consultant. So I'm going to talk about that credential a little bit and why it matters, along with mental skills and performance topics, and then just contexts and populations that you'll see mental performance work in. So, to begin, we're going to talk about what mental performance isn't, or what mental performance consulting isn't, I should say. It's important to be clear about what it's not, and that can just give us an idea of what the scope might be. Um, we don't want people accessing inappropriate care. So if you have an ethical mental health professional working with you, they'll let you know like what's within their scope and what's not, or even within their own competence. But mental performance consulting is not psychotherapy and it's not clinical counseling. It is not diagnostic and it's not here to treat mental illness. It also isn't crisis intervention, though we are trained in supporting people to access the appropriate care when a crisis does arise. And just to be clear, that it's also not a replacement for mental health care. Sometimes some of the misconceptions we hear are, oh, well, mental performance consulting is just therapy for athletes. But that's not actually true. That it is, I'll explain more exactly what that is in a minute, though. Other misconceptions you might hear are, oh, it's only for elite sports. So, like, only Olympians or high performers. That's also not true. Um, I work with athletes who are as young as 6 years old, and we talk about mental skills and mental performance. So, it's not just for elite sport. Other misconceptions you might hear is that, oh, and I think this is true across a lot of other therapeutic um, modalities or therapeutic supports is that, oh, it's only meant for when something is wrong. That's another misconception we'll hear a lot. And again, just to reiterate, like it isn't a mental health care replacement. It doesn't replace mental health care. A lot of times, mental performance consultant work in collaboration with or concurrently with mental health care for the athlete or for the performer. So sometimes we're also embedded in teams. And so you'll see like there's the coach, but then you'll see the strength and conditioning coach or massage therapist might be in there, sports med doctor, athletic therapist, dietitian, and a mental performance consultant. So we do work within a team framework sometimes. Sometimes we just work individually on our own. Um, it just depends on the context that you're working in. So those are just a few misconceptions. So I just wanted you to know like what is mental performance? Well, when we think about mental performance, it's the capability to use cognitive processes, mental skills, and self-regulation skills to consistently perform in challenging environments. So it's often seen in sport, but it's not the only context, and we'll talk about that a little bit more in a little soon as well. But the premise is that mental performance supports well-being, personal growth, and goal pursuit. So, for example, if I'm trying to teach an athlete to use their nerves to focus and regulate emotions or sensations that they're experiencing so that they can execute under pressure. I'm not trying to eliminate anxiety, for example. So we're just looking at the cognitive process, but it's hard to tease apart every tiny little area of performance. So, but I just like to zoom out. When you think about mental performance, it's more in the world of optimization, adaptability, and excellence. This is where we'll see mental performance come in. Which brings me to a description of this acronym called FAST. FAST stands for feelings, actions, sensations, and thoughts. And that's really at the core of what a mental performance consultant will work with. I mean, each individual section, but they're all also interrelated. So mental performance is concerned with your ability to monitor and manage your FAST um, so that you can achieve your personal goals or your performance goals. So to expand on the example from before, if the performer is noticing their feelings of nervousness and they're feeling really excited before they go on stage, there's a continuum of how all those things feel to that individual. Um, the sensation in them, so their feeling might be excited or nervous. The sensation is like, ooh, I get like that butterfly feeling in my stomach or sweaty hands, or I can sometimes athletes will say like, oh, I can just like hear my heart in my ears. That's another sort of sensation that might come along. Thoughts, there's a whole range of thoughts, but in this example, maybe they're thinking like, oh, what if I mess up? That might be one of the thoughts that we have to come in and, oh, well, maybe we need to shift that thinking. And then what are the actions that result of that? We're rushing, we're avoiding eye contact, which depending on your sport might be important that you are actually able to you're able to remain in contact with the audience, for example. So like I'll work with some dancers and audience interaction is really important. So in a nutshell, mental performance is the ability to notice the fast cues that you have and respond skillfully. And it can use a variety of techniques. And so that's where the mental performance consultant comes in. We kind of help with management of that. So when I say like when we come in, what do we actually do? We help to develop the mental skills for optimal performance. We help performers consistently execute their best under pressure. And we assist in overcoming performance obstacles by helping the individual reshape their thinking. There can also be parts of this where it's recovering from injury. A lot of psychological processes happen in return to sport after injury. We also help improve team dynamics and educational through like education and workshops. Generally, it's on mental skill development. Um, it can be around team cohesion, communication, leadership. So there's a broad range of topics that fall under team dynamics, but you might have a mental performance consultant come in and facilitate a workshop, for example. There's a huge education piece as well, depending on the need of the group. Mental performance consultants, like I said earlier, we also collaborate with other mental health professionals. So our scope of practice, which you'll see in a little bit, like why is collaboration such an important piece? It's important because our scope of practice really, if we're operating from a place of ethical practice, we shouldn't be doing certain things, and that we have to stay in our lane, but know who to reach out to when we have to do that. So overall, mental performance consultants support wellness and well-being, personal growth and development. So you'll hear that a lot, like as I go through this mental wellness, mental well-being. And I'm going to draw your attention to the C in the CMPC. So that stands for Certified Mental Performance Consultant. It is registered, it's trademarked, but I wanted to walk you through the process a little bit um, here because the title CMPC does give some credibility to the industry. I'll talk a little bit in a minute about the confusion around all of that. But to be a certified mental performance consultant, generally you need to have a master's or a PhD um, in applied sports psychology or counseling or a related field as a whole, but then within your degree, whichever one you hold, you also have to have specific courses in sports psychology. Um, not just the theory of psychology, but the applied sports psychology foundations, um, also exercise, sociology of sports. So there's like a breadth, but also a depth to the requirements you need for education purposes. There's also um, practicum requirement to become a CMPC. You have to have completed 50 supervised mentored hours, and the other 350 hours are indirect consultation, but specifically working with athletes and coaches to develop mental skills and strategies. So then once you've completed all of those credential pieces, then you are able to um, challenge the exam. So you have your mentorship, your specialized training in mental skills and applied sports psychology, and the uh, practicum piece. Then you do the examination, and if you're successful in passing the exam, then you become certified. So it's not just like on the weekend become a mental performance consultant, or over 6 months you can become a mental performance coach. We'll hear that term used a lot as well. And why I think it's important to draw your attention to this is because we're bound by ethical standards. We also have to engage in continued training, like continued education, to maintain our certification. So it's not just like a one and done. You get the certification, you have the stamp, and then you can just continue practicing. It really it's the minimum standard for mental performance consultant. So if you're working with somebody who is a mental performance coach, and they don't have their CMPC certification, that doesn't make them a bad mental performance coach. It just means that maybe you want to ask some more questions around what made you get into sport, for example, or what other training have you done to specialize? And I think as practitioners or like others in the mental health space, it's also like you're like, oh, like I have maybe one of your clients is an athlete and they are struggling in very specifically in their sport domain. Um, and you're like, I don't know, this is like feeling a little bit outside of my competency in terms of exactly what they're looking for. That you know that, oh, maybe in my area, I'll see if we have any CMPCs. So if you go to our certifying body, which is we call it ASP, but it's sorry, I'm just going to the Association for Applied Sports Psychology. That's through the US. But we're certified through them in Canada and also the Canadian Sports Psychology Association. So if you go to either one of those websites, there's a directory and you can look up people and put in all the different criteria. I think it's a little bit like psychology today in terms of finding someone appropriate, but they're only men's performance consultants. The Canadian site, we didn't always have the CMPC credentialing. That's been new within the last few years for requirement to be a professional member to the Canadian Sports Psychology Association. So their website has all of the Canadian practitioners, but read their bios and you can look them up in other ways to see if they are fully certified or not. Um, they're still in like a transition period. So I just wanted, like, as a practitioner, give you some thought into where you can go to find other mental performance consultants. I think so far, like in Kingston, I've met two others. That's not to say there aren't more, but it's just interesting. There aren't a ton of us, I should say.
Mhm.
So I bring your attention to like why look for CMPC. It is complicated. It's confusing because there's so many terms used. It's not a regulated profession like social work, like psychotherapy. Sometimes you'll see it's almost a lot like life coaching in terms of just being able to use titles. You have to be certified to use the CMPC title, but you might see people just say, I'm a mental skills coach, or you'll see cognitive performance coach, mindset coach, resiliency trainer. And so they may have done other training in other with other organizations or institutions that allow them to use those like you would in life coaching. But really, the CMPC is just like the minimum standard that you probably want in a practitioner for the most part. So I just find it can be really confusing, even within our industry. We just had a full, at our last conference, like lesson handed to us, if you will, that we're not all of us aren't using the same title across all of our social media platforms even. So like maybe on social media, I was a mental performance coach and I was for a long time. And they're like, actually, you're a mental performance consultant, not a, so the language can just be really confusing. So I think it's really helpful that we're doing this and putting it out to the public so you have awareness that we're not all built the same. And so it's good and important just to do your own homework. Um, I don't want that to undermine though. Like if you have a really good connection with the person you're working with, like that is extremely important. And that's not to say like if your psychotherapist specializes in sport, that's just like maybe just an interesting topic to bring up in a session sometime of like why sport? Like what drew you to it? But if they're not, we call it duly trained, if they're not holding a CMPC title and psychotherapy, then what qualifies them, I guess, is the question. And that's up to you to decide as the individual or the client to like what's my line. And so I think it's just an interesting point of conversation to have. So that's my plug for why to look for CMPC. But then I get, what about a sports psychologist? So this isn't another like one of those things where in Canada, at least other countries have different regulations. Um, when people hear sports psychologists, sometimes so long before mental performance consultant came, we were referred to, this was before me, but the industry was referring them to as sports psychology or sports psychologist like associates. So there was a lot of confusion in that. But then psychology became a term that you couldn't use unless you were a psychologist. It became protected. So in Canada, at least, a psychologist has their master's degree or PhD, depending on the province. It varies, their licensure. But they're psychologists first, and then they specialize in sport. So the sport piece really is just a descriptive term of the services they provide, the population or the context that they work in. So it's a lot like a psychotherapist who has training or interest in like family counseling, for example. You're not called a family counselor by title, like your actual licensure means you're a psychotherapist that does family counseling, right? So that's kind of a little bit like that in sports psychology. But the other thing is the cool thing about psychologists, they have a greater scope of practice. So they can diagnose and treat mental disorders. They can do psychological testing. So and sometimes they are dually qualified. So they are also CMPCs and psychologists. And in the US, it's different. In the UK, it's different. So you might actually have a sports psychologist that you follow on social media, for example, and that title is true for them in their designated area. But in Canada, the term sports psychology doesn't actually like exist as a licensed title. It's psychologist with a specialization in sport. Um, and even like as a CMPC, we'll often work with other, sports psychologists within a team, but they're managing, say, someone's trauma response. And the CMPC is working on very like focused within their mental performance domain. So like even me in the industry, I'm like, I get why everyone is confused about like, what do you do and who do you work with? So you can, again, like, how did you specialize in sports? Sometimes it's because of experience, or they just find that's the clientele they've been working in or the context. And some have continued on and gotten duly trained, which is really cool. But again, mental performance consulting is not replacement for psychology or sports psychologist work. Yeah, so we just work pretty collaboratively, which is fun. So I thought this is like a easier way to conceptualize when and who based on like a mental health continuum. And we look at like on one side of this continuum in crisis and struggling. Often those states are a little easier to identify within ourselves. Like we know when we're like in those struggling crisis states. But when we're on the other end of things, there's thriving and excelling, and in the middle we have surviving. So a CMPC, it's just good to know who to work with when you're at different states of mental health. And this is what I'm always trying to hold in my relationships with my clients is like I'm constantly monitoring where they're at here because some are in the surviving, category here. But if they start to trend really far in the orange or in the red, this is like indications for me, which is why I think creating a referral network is really important of reputable clinicians who can support clients. Um, and if you, as a practitioner, are working in mental health and you're not like that's way outside of your scope as a CMPC, so or an MPC. But that's not to say that you're a psychotherapist. Like if we look at yellow, this is like we can have CMPCs, psychotherapy, social workers, counselors, and then we move up to the green and excelling. That's not to say they can't support you and you're thriving and excelling in life. Pardon me. It's kind of just like the bread and butter of CMPC work. But then when you go on the left, that's, psychiatry, clinical counselors get added to the mix, primary care providers, even like your GP or nurse practitioner, for example. So if you find and so I've had to refer clients out completely because of what's going on in their life as a whole has created so much distress and disruption to their everyday life that mental performance work it does have to take a back burner. And that's also not to say that working in mental performance doesn't have an improvement in other areas of your life too. You don't just exist. And so what's really important perspective that I take is like, you are a person first. Athlete is some like, where I'm centering you as a person, not as an athlete in my work. So I'm constantly thinking about all of that stuff. And then you might see, like in the thriving and excelling, you do have a coach, a performance coach, a life coach, a whatever kind of coach. There's so many and it's similarly, not everyone is the best fit for you. So it's important though, as clinicians to know, like, oh, like, and sometimes I have to consult with the psychotherapist that I work with or the social worker. I'm like, I think like this is your lane, not my lane, and maybe we need. So there's also like you're really involved in the process as a client on what your care looks like from my perspective and how we go about ethically. communicating with other clinicians around the work that we do. So yeah, I just find like the mental health continuum is a great way to just conceptualize like, oh, like maybe this work is better suited or maybe not. And so it's just, I find it's helpful. I'm not going to dive so deep into this, but I just did want to point you to like resources online. If you're not in, like we're in Kingston, but if you're not in the Kingston area, there is a site called they're located out of Ottawa. They have bilingual options as well, but the Canadian Centre for Mental Health and Sport. They are a great resource available to just the public in terms of gathering information. Their population is for high performance. So if you're at the grassroots level, but you're not really sure who to contact, I mean, it's a great starting point. But they do have a referral system. So I would say like go to their website, browse around, but you can see here like what are the different education requirements? Who are the registering body? What's the scope of practice for different types of mental health practitioners? So on one end, we have mental performance consultants, and then there's counselors, psychotherapists, social workers. And then sort of in the middle, we have the psychologist, then medical doctor, then psychiatry. And all along the way, under here, when we look at scope of practice, sort of like at the bottom there, it tells us that, we can improve sport performance and mental health. And so can a counselor, that the caveat is only if they're duly trained. So it's just this is best practices, right? So this is just an easy, great resource. You're like, ooh, where do I go? Where do I even start? So I just like to point people's attention here. Okay. Who's who and what's what? We're actually going to talk about mental skills, what mental skills are, like which ones we see often. I like to use the gold medal performance or gold medal profile for sports psychology. They break it up into the gold, silver, bronze. That doesn't mean one's more important than, but the fundamental, the self-regulation piece, and the interpersonal. This is an evidence-informed framework, and it outlines the key mental performance competencies that are associated with podium level athletes in the Canadian high performance sport area. So it's not an exhaustive list of all the mental skills that you might see, but it was developed for practitioners. And it has 11 different competencies. So under gold, you'll see motivation, confidence, resilience. And then in the silver, the self-regulation skills of self-awareness, stress management, emotional and arousal regulation, and then attentional control. So these are topics that as a clinician, you're like, oh, I don't know, like they're talking about these things in their sport specific. Is that within the scope of CMPC? So this can be a helpful framework to just lean on. And then in the silver is the interpersonal. So the skills that are required between two people or people. And then you'll see that's like bidirectional in all the areas. And then surrounding all of that is your mental health. So we can't tease apart just one of these things. Oftentimes working in one space influences another. So you'll just your mental health and your well-being influences all of these things. So you can see how it's like super interconnected. But again, it's not an exhaustive list. It's just like a really great model that I think and it's relevant. It's very current. Okay. So what are some of the topics and concerns that CMPCs manage or deal with or lean on? So like any, I think, practitioner, we don't always do like we also specialize. So I don't always work with injury, for example, like injury recovery. That might not be my area of specialty, but another CMPC does. So even within our industry, there are people who specialize in specific areas, but this is just very broad. So certain topics and concerns we see are goal setting, focus and concentration, confidence and self-belief. So you can see like all of these things are also alive and true outside of sport or outside of your performance domain, and maybe it's in your work performance domain. Um, Motivation, commitment, management. So we'll often do like imagery and visualization practices as an option as well. We also speak to a lot of these topics in workshops. So if you're just trying you're a coach and you want to introduce topics, this is a great just place to start of like, oh, like my team's really struggling with, staying focused and concentration. Like, can you come in and do a talk on it? And then we'll just try to customize it to your group. And then so these are very like performance mental skills. Then we have performance barriers. So a client might come to me and say like, "Ooh, I'm having a lot of like pre-performance anxiety. My nerves are crazy. I just can't get them under control." That's one of the big reasons why I see people come to me. Um, there's self-doubt or limiting beliefs, along with like high pressure, like how to manage myself in high pressure, high stakes situations. Like we've got the Olympics coming up, so you can probably use that a little bit as a case. You'll even notice like here, like rebuilding performance after setbacks. Like how are athletes managing themselves after there's a dip in performance or they make a mistake? Like you sometimes it's visible, and sometimes it's just very covert and internal. We don't always know, but I think it'll just be a fun thing to watch with the Olympics coming up. Um, they also have some extra barriers that they're managing right now, I think. Let's see. Oh, too far. So when we look at the well-being topics and concerns, others topics that we might, which is what I really like to work in, is like balancing performance with personal life and well-being, stress management and regulation strategies, also promoting a healthy mental performance culture. Sport can be, sometimes like mental performance, you see a lot of perfectionism or all or nothing thinking. And so if that messaging is perpetuated throughout the whole organization, like a mental performance consultant can also come in and speak to those things. And then there's also interpersonal and team focus. So team dynamics, team cohesion are topics we talk about often. Education, so providing education for coaches and parents. Sometimes we put a lot of pressure on the athlete to be able to manage all of these things, but if there's like a system or culture problem within the team or organization, it's really helpful to involve the parents and the coaching staff. It's not just on, and a lot of times, like I see it in youth sport when we talk about parents, is like, ooh, my child. But then I think, okay, like, ooh, what about the parent? So, or how about the coach? When there's a coach athlete relationship, that was in the interpersonal, that's really important in your performance domain and your performance context. And then again, there's communication skills. So that's another area that we also can speak to. But sport isn't the only context that mental performance consultants work in, or that you use mental performance skills or mental skills training is what you'll see as well. So we do have sport and we do have team sports, but there are also within the Canadian Armed Forces, not in the regular military side yet, but in like the special operations side of things, they do have certified mental performance consultants on their staff who help train our soft community. And then there's also like within the healthcare, we think about like surgery, a surgeon's going in, it's a very high pressure, high stakes experience. It's a similar idea, like how do they manage themselves? And there are really cool programs like uh I think it's out of Manitoba. One of their residency programs is using a mental skills or mental performance consultant and a mental skills training program for their residents. Nurses use it, physicians, so it's not just footwear sport. And then in the performing arts space, they have CMPCs working with Cirque du Soleil, different orchestras and musicians. There's also like performing arts, dancing, acting, actors. So if you think too, like, oh, I have to make like a big public speech, you can flex your mental skills here. You can learn mental skill techniques to help manage yourself to be able to perform in that context. And also in education, students and teachers use it. Maybe you have pre-exam anxiety, and so we can lean on similar literature and strategies to help manage those things. But a lot of times when I'm working with youth and I'm bringing up uh, growth mindset, for example, I'll ask because they teach it in a lot of schools, or a lot of teachers will include it in their classroom. And like I did a workshop, there were probably like 50 um, performers from like age 6 upwards to 18. And like 80% of them knew what a growth mindset was. And I think that's just like the coolest thing. Like I learned that in adulthood. I don't know when the concept fully became, known by everybody, but I just think it's really cool. So that's all to say that the context isn't just sport, where mental performance consulting, mental performance skills are flexed, it touches every area of your life. So just to end here, I just want to take a moment to make sure the messaging sinks in that like mental performance is part of your mental health. Um, and so mental performance consultants really work at the intersection of that mental health, mental performance space. And so if you have any questions, here's my email. You're welcome to email me and message me. Happy to talk about this stuff all the time. But yeah, I thank you for your attention and just getting us to this point. And thanks for having me.
Great. Thanks, Kayla. That's so interesting. I had no idea about sort of the other context like we were talking about, like within the military and stuff like that. That's really cool. Um, yeah. And just, as a personal note, kind of going back to that continuum that you had up, it's been nice to kind of be in contact with you because then, I've had clients that I see that kind of when we're out of sort of that maybe in crisis mode or something. And then like it comes up later where maybe they're an athlete or whatever the context may be to be able to provide your information to them, which has been super helpful for me to be able to get to know you and what it is that you do. So yeah, it's very interesting.
Thank you. And like, so we're a military family, so we've
Mhm.
moved a lot. And, I'm always rebuilding. Like, while I have virtual referral networks, I think it's really important for me to have uh,
Mm.
referrals here that I can like feel confident in and saying like, here, go talk to this person. I think when I'm extending a referral, it's an extension of me and my own professional practice and opinions. So yeah, I think like this has been really great. Just also like going through all of this. I'm like, no wonder everybody's so confused about what the heck we do.
Well, it's great information to have because, yeah, like, and I'll admit, like, I knew very little about
Yeah.
your profession and what it is that you do and all the different, the differences in it and everything. So it's been very helpful for you to be able to break it down. So I appreciate that. Okay. Well, so just to let everybody know that we do offer these free webinars monthly. So keep an eye out on our social media and on our website for upcoming webinars and also workshops that we have within the office. And again, if you're looking to book in with a psychotherapist or social worker, like I referenced at the beginning of the presentation, we have a whole bunch of us on staff here. And also, if you are wanting to connect with Kayla, I know she provided her email, but feel free to reach out to us as well, and we can get you in touch with her too. So, I guess, unless you have anything else, Kayla, I will stop recording.
All right.
Okay.